The rise in cases of female genital mutilation is fast becoming widespread and worrisome. FGM, which involves the partial or total removal of external genitalia or other injuries to the female genital organs for other medical reasons, is a practice that has no health benefit, but rather harms the victims both physically and psychologically. The United Nations Children's Fund has said Nigeria accounts for the third highest number of women and girls who have undergone female genital mutilation, with an estimated 19.9 million survivors. While many are against the practice of female genital mutilation, some few others are still bent on this practice, which infringes on the rights of a person's health and security. Joining me in the studio to discuss the causes, effects, and solution is the Program Manager, Hazy Health Initiative, Emmanuel Oni. Good morning. Thank you for joining us.
Good morning. Thank you.
Now, you have been on the field and you see what is going on. Talk to us how far we have come with putting an end to this practice. How far have we come to challenging the discriminatory reasons about this whole issue?
Yes, thank you. So in my experience and in what we have seen so far, we are not there yet, but there is a reasonable progress. You know, one thing that we need to continue to do, or that we have been doing, basically is increase in advocacy and awareness, because it's really not as if people don't know about this thing. You know, everybody knows that it has, or most people know that it has negative effects, but there is this, it's our culture, it's the way we do, it's how we do things. And so we need to intensify effort, basically, in order to make us get to the target, or make us get home, as it were, on this issue. And one key area that I think that we have been doing well, and we need to do more, is the engagement of men and boys in the advocacy. Right. Basically, if we do an analysis of this problem, at the root you see colorations of patriarchy in the society, and if you do investigation, you discover that most of the reasons that are unsaid why people practice female genital mutilation is for satisfaction, so that your husband will be happy, so that when you get married, you know, you will be seen as a social woman, or a woman that was well trained. And you know, so looking at that, we need to let men and boys know more that this thing has more harm than good for their wives. Basically, there is no good at all that FGM would do for your sister, your mother, or your wife. And so I feel like we have been doing something around that, and we need to intensify, you know, more on that at the grassroots level, to let men and boys
be a part of the advocacy.
Yeah, basically.
Right. So now let's understand the challenges that you perhaps have encountered on the field while trying to change the mindset, because this is about a mindset shift, which is quite a challenging thing to do. So talk to us about the challenges you have encountered while on the field.
Okay, so one of the things that we have noticed about changing mindset of men and boys is, like I said, culture, or their perception of what culture is, their perception of what is right and what is wrong. We have spoken with religious leaders, we've spoken with traditional leaders as a means to, you know, enter these communities, because usually these people will listen to people that they trust the most. You know, if your community leader comes out to say, this is right or wrong. So most times we work with these community leaders and religious leaders to speak with their people and let them see from the mouth of their leader why this practice has to stop. But the common thing that you hear most of these young men say is, well, we did not know that it has this effect. In fact, some of those young men, when you show them videos and clips of, you know, demonstration of what FGM does to women, they're like, are you for real? Is this real? Like, we never knew. And so I feel like ignorance or lack of access to information is a major challenge for most of them. But with increasing efforts in working with their, you know, community leaders and gatekeepers to increase access to information for them, we are seeing changes, you know, basically. So, and I believe that if we intensify these efforts, we're on the right path to eliminating FGM in Nigeria.
Right. Now, there are those who say that perhaps the way this advocacy is being put across might be something to also look into. That instead of coming out to them to say, you know what, this is not ideal, this is not good, we should also respect their belief, and also know how to, you know, put across these messages while still insisting that this is not ideal.
I agree with that. And like I said, we work with, you know, gatekeepers in communities. So I give you an example. We respect people's faith. You have the right to believe, you know, your faith, right? Whatever you believe in. And so we have worked with religious organizations, churches, mosques, traditional religious leaders, and we speak with them to say, okay, where exactly in your faith is this accepted? And you hear most of them say it's not allowed. For boys, you know, you can say circumcision is good, you understand that. But for women and girls, there is nowhere, you know, where it is. So having that at the back of our advocacy gives us strength, gives our message, you know, voice. So when we go to churches, to mosques, to traditional community, and we stay with community leaders, traditional leaders, it's easy for us to talk because they can easily come and say, look, there is nowhere in the Bible where this is found. There is nowhere in the holy books where you can see this. And even the long-standing traditional religion that we have, you know, in Nigeria, or let's say that our people practice locally, you ask them, so how does this add to life or productivity for your people? And they really can't give you an answer. What you just hear is it's a long-standing practice. And so for those kind of people, we begin to show them the health consequence on women and girls, and to say, if this thing really is just a long-standing practice that has no effect on your community,
what has it changed?
Exactly. Why not just let it go? You know, basically. And I think we are making progress that way, because usually if you just come and say FGM is bad, you should stop FGM, people will attack you. You know, but when you come from the angle of, okay, this is where you're living, this is how you have lived. If you remove this problem, or if you remove this component from your way of life, what exactly will change? What exactly will go wrong? Most of them really can't tell you what will go wrong. So we say, if nothing will go wrong, why not just remove that part of the culture? Yes, we understand that culture, you know, distinguishes us. It makes us unique, as it were. But parts of culture that are not productive or positive should be removed, absolutely. And so that is the angle we come from in community advocacy, to say, okay, in your faith on how you live, can you tell us the advantages that this has done? They probably will not be able to say. So we put it forward. Can it be removed? You know, and I think we've seen, you know, substantial progress in that, you know, in that area.
For the benefit of those who are watching us now, who might be saying, perhaps, what are even the risk factors associated with FGM? There's those who still do not understand what the risk factors are, and why, you know, there is this advocacy that there should be an end to it.
Yeah, so by way of redefinition, female genital mutilation is all procedures involving the partial or total removal of the external female genitalia for non-medical purposes. And if you talk about the consequence, there is a short-term consequence and there is a long-term consequence. You know, on the short term, either it is done by local circumciser, or even, you know, some of our trained, we are advocating against that, and we've seen cooperation from necessary organizations to stop medicalization of FGM. So either it's done by a local circumciser or a trained person. One of the short consequences that you see is hemorrhage, loss of blood, you know, and you know, when a woman loses too much blood, it can cause some other physiologic effects in our body, you know, shock, death, coma. You see pain, excruciating pain. If I had the time to show you clips that we've seen on field, or you hear people narrate, survivors narrate the experience, you can't imagine the pain they went through in the process of female genital mutilation. Because while some are mutilated at childhood, you know, 8 days, 40 days. We see in some communities where women are mutilated just days before their marriage. I mean, mutilating a grown-up woman, a grown-up woman days before her marriage. You can imagine the pain she goes through. So on the short term, you have hemorrhage, you have pain, and you know, other physiologic consequences. But on the long term, I usually talk about stigma. I usually talk about the trauma they go through. You know, it is one thing to experience pain, excruciating pain. It's another thing to live with the effect of that pain. Every time you remember, there is a trauma that comes with it. On the stigma aspect, you know, there is a limitation on their productivity because you feel incomplete. For on-air sakes, I would not want to bring stories, but we have seen stories on field of women that do not enjoy their marriages. They cannot even marry because who would marry me once they know that I'm mutilated? I do not have, they feel incomplete, let me use that word. And because they feel incomplete, they can't really go out to say, I want to get married. Even when men approach them, they cannot. And sometimes when they get married, they have birth complications because their female genitalia has already been, destroyed. Well, I don't want to use the word destroyed. Let me say distorted or
distorted.
Something like that. And so when they even get pregnant, if they get pregnant, all right, to have children is a problem. And so you have a lot of them have birth complications. A lot of them have to go through difficult times, you know, giving birth to children if they ever get to conceive at all. And then there's infection because, you know, female genital mutilation have types, all right? I didn't go through that earlier. So there's type 1, which is clitoridectomy. There is type 2, which is infibulation. Particularly areas where they practice infibulation, it's very terrible because they remove the external female genitalia and sew it back with needle and thread. You see, so what is left of the external opening of the female genitalia is so tiny that traces of urine and, you know, menstruation waste during their menstrual period get stored up in their body, and that causes infection. So you see that woman over and over again treating infection. You see that woman over and over again having pus and all of that. And obviously that destroys our organs the more, you know. So it has short-term and long-term consequences on both their health and productivity.
Right, that's a lot of information that I believe will give a lot of persons insight into why there is the need to put an end to female genital mutilation. But let's look at the aspect of government now.
Yeah.
How supportive has government been in the drive to ending female genital mutilation? Have we made the right investment, or are we making the needed investment to put an end to this?
Yeah, so looking at the government in the context of Nigeria, I think we are doing great. You know, we are on the road, on the right path. We only need to do more, you know. We need more investments. We need to unite together, fund more, and, you know, invest more. So particularly, we have laws in Nigeria that prohibit female genital mutilation. The federal government passed the
How effective has that been?
Yes. So, you know, it is one thing to have a law. It is another thing to
implement.
Exactly. So on the aspect of, are there laws? Yes, we have laws. Now, on the aspect of implementing, I would still not blame the government, you know.
Why not?
Because we have security agencies.
Aren't they part of government?
Well, so in our experience, the issue we've seen with reporting and prosecution of perpetrators of FGM is with the people. You know, there is this thing of, will I report my grandmother or will I report my mother-in-law?
Right.
Yeah. So even when there is the law, even when there is the protocol, and part of what we have done, you know, in my own team recently, is to work with grassroots communities to provide reporting channels. So we decided to have focal persons in communities that, you know, if you see an impending case of FGM or just freshly done, you can just reach the person and the person will reach the right authorities. And even with that, the number of reporting that we've seen are not so much, and out of that cases reported, we've not seen prosecution. And the reason basically is because when you try to report or when you bring up, the security agencies will ask you for witness. So who's going to witness against his mom or his mother-in-law that, you know, because you know that it has jail terms, it has fine terms. And so the question is with our people, you know, and that is why most of the advocacy work that we do, we try to encourage communities to let us name and shame perpetrators.
Right.
Because when we do this, it will serve as a deterrent, you know, for other people. And also, we also see a need to consider. That's why I said we're on the path, but we need to do more. So when I mentioned security operatives, it's not as if we have 100%. They are doing great work. The Nigerian police, the NSCDC, at the community level, at the state level, they are doing a good work. But they need to do more. We've seen cases also when people come to report and you hear things like, people should go home and settle this. Because if this gets to the courts, are you going to, so basically they are doing great job. They are doing great more. We only need to work with them more to educate more security operatives.
Right, that was where I was going to, educating them to understand why it is necessary to name and shame.
Exactly.
Right.
Exactly.
So now the other issue is the 2030 target of ending female genital mutilation.
Definitely.
You say we are on that road.
Yes.
And if we would get to that point is where the question lies. Will we be able to end female genital mutilation by 2030? That is just about 8 years away from now, if I'm right.
Yes.
And then what more, aside those things that you have mentioned, how do we, get having a wholesome approach to addressing this issue?
All right, thank you. So I believe that we are on the road and we can achieve this by 2030. However, this has to do with us as a people. We have to understand our context. We have to understand that even though there is a government, there is the public service, we own the country and we can make it work or we can make it otherwise. And so most of what we need to do basically to make this a possibility relies with the people. We need to talk with the people, because in the first place, if every man, for example, decides that in my home FGM will not happen, we probably don't even need to report FGM, because every man is the head of his house and he can rightly say, in my home, my mother-in-law, my wife, nobody should mutilate my girls. I mean, that's kind of power that men hold. So if, for example, if all men in Nigeria would stand up and say, in my home, no FGM would happen, and we bring that together, you can see the force that we will generate, and that alone will go a long way. Because if you look at this practice, you see that most of the custodian of the culture probably are old women. That is how we've been doing
the
it.
elderly.
But if you look at the custodian of power, it's the men. So even though these women are the ones responsible for doing this thing and continue the culture, the men in the community can say, in our community we're stopping this. And you see, that is one of the things that we began to do in my own team recently. We began to work with communities to get them to pledge to abandon FGM. All right, traditional leaders, religious leaders, and even families, to get them to pledge and to say, in our own community.
Are they committed to the pledge?
Yes, definitely. If I'm allowed to mention, we currently have more than 100 community leaders that have already pledged in 2021 to say we are abandoning FGM. All right, and we have over 1,000 families that have pledged, if I'm allowed to, say the numbers, definitely. So we have about 1,900 families in our record who have pledged to end female genital mutilation. And I'm saying that if only we can sincerely mean these things, all right, and more families can do this, more community leaders, more religious leaders can say it on their platforms, on their podiums, so that more men can be involved, more men are engaged, and more men can take responsibility for their home. For a person, if I get married, because I'm not married, if I get married,
then it should be when I get married.
When I get married, and something happens and I hear that my daughter was perhaps, I don't want to know who did it. The person is going to, it's simple, you're going to jail.
Right.
Yeah, so if every man is like that, to say that I'm not doing this thing, and if I by any means catch you trying to even do it, you would face the music, you would face the consequence. I believe this will go a long way to help us end FGM in the next 8 years. Yes, we can do that.
For the women who are similarly victims, what should they do?
Yes, so for victims, thank God that Nigerian health system is also trying their best, health workers. And so particularly, they need two kinds of care. Basically, there is the curative part, for people who have complications already. Maybe they cannot have children or they have cysts, because we've seen things,
Right.
You see people who they develop cysts or all kinds of stuff. And so you might need some surgical intervention and all of that. You need to see a medical practitioner or health worker. And also there are people who need counseling because of the pain that they went through in the process. They have trauma, they have a lot of mental issues, psychosocial issues. So basically I'd advise them to see a social worker or a mental health counselor. That's the first aspect of it. And if you want to prosecute, as a survivor, you want to lend your voice, or you want to be strong, stand for other people, and you want a prosecution of your case, it's easy. Just make an official report to security agencies, either the NSCDC or the police. They have the gender desk officers in Nigerian police and in NSCDC that can take this up. And I know that Ministry of Women Affairs in different states also have gender officers that actually on standby for cases like this. So if you want to prosecute legally, you can actually reach out to these people and they would help you on the right path to what to do next. You can also reach out to my organization. We support women and girls who want to take action in this regard. And
that's Hazy Health Initiative, in case you want to push for any of this that he has mentioned. Thank you so much, Emmanuel Uni, Program Manager, Hazy Health Initiative.
Thank you very much.